What's up, guys? This is Ryan Smith here for PT on Ice this morning with the title Postpartum Strength. I am the COO of Recharge CrossFit. I'm also a faculty of ICE, obviously, of the Fitness Athlete Division. I teach the course, the Clinical Management and the Fitness Athlete, both online and the live course. So let's get right away into this. So the topic is postpartum strength. Here at Recharge, I run postpartum fitness classes and work a lot with women from a physical therapy standpoint who are postpartum after pregnancy, looking to get back into CrossFit, looking to get back into the gym, looking to get back into strength training, etc. So I want to break this down a little bit to what these women have really taught me, because I haven't truly had what I'd say, formal DPT education on that matter. We didn't get really much of it at all to begin with, because in general, people consider it a specialized route. Well, for one notion, I want you to kind of get that out of your head and consider that the pelvic floor is a group of musculature like any other in the hip that needs to be addressed for certain individuals. Most specifically, we need to really understand this for postpartum population. If we're going to be community leaders within the environment that we are at, we need to understand strength training and movement throughout all populations and lifespans. So today we're going to dive into postpartum strength and that postpartum population specifically. The big things I want you to know and what we're going to dive into is that realistically, you don't need a whole lot of book and education smarts to go into pelvic health if you've never tried it before, right? Or if you've never worked with individuals who are postpartum or with women who are pregnant before and still looking to maintain strength training. What you do need to understand and develop is a baseline and understand the principles of strength and conditioning. You'll be pleasantly surprised that a lot of the same strength conditioning principles that you develop with your own movement practice can be applied to all sorts of populations, and that includes postpartum women who are coming back after pregnancy. So from there, what we need to understand is what happens and what occurs and how the body changes for these women. Now, you can read up all about this. You can study what happens, what it goes through, the hormonal changes, all that stuff. But what you can also do is just listen to the women around you. I've learned more from working with women in postpartum classes about the entire process and how they feel and the physiology of it than I have from any other really thing I've taken before. So I've gone to a few courses on women's health, but really listening to the women in my classes and listening to my patients who are women coming back have given me a ton of perspective and a lot of tools to use with people that I continue to work with. So some of these things include, one, the daily capacity, the daily demands of a mother, both during pregnancy and after pregnancy, is significant. And that moms postpartum should never be looked at as weak by any means, right? They have an insane capability. Consider this, a baby carrier, right, that you put in and out of a car with a baby in it can be upwards of 20 to 30 pounds. So every time on the first day of a postpartum fitness class, I have women at least farmers carry unilaterally 20 to 35 pound kettlebells. You need to understand this, because if you set the narrative from the get-go that what is being demanded of them after a significant event, such as pregnancy, that we need to start there. We need to develop, how do you feel with this? How are you maintaining this? Because for the next 6 to 12 months, they're going to be put through the ringer in terms of what their body demands out of them to not just provide for their children, but also for their family in a physical sense. So that's one. Don't underestimate and don't look at women who have just had pregnancy as them being frail or weak by any means. On that note, we need to understand that there is a recovery process after pregnancy. I'm absolutely floored at the societal pressure that's put on women after pregnancy to get back into this, ridiculous shape, to get a flat tummy again, to do all these things. And it's perpetuated largely on social media. And it's like nothing I've ever seen before. I gave a talk at CSM last year on the differences of gender within physical therapy and rehabilitation versus men versus women. And the pressure, the expectations of women post-pregnancy is so high, and there's so many expectations from everybody that we need to be the practitioners who don't set that expectation, that we understand that pregnancy is a significant event that can be considered trauma to the core and pelvic floor area, And we need to understand that that recovery takes time. If we can provide an environment and nurture that environment to allow that healing to occur, give them permission to be okay with that, that's the best case scenario. For every social media post that you see of that mom who just had her baby and 3 days later is running a marathon, I guarantee there's hundreds, not thousands, of other women who are like, how is she doing that? And I'm over here and I'm having incontinence issues, I'm having pelvic pain issues, I'm having prolapse issues or diastasis recti issues, I'm having all these things going on. I guarantee that is more of the common theme amongst many women other than those that are running marathons. I have nothing against those women that do that. If they feel up for it and they feel okay, that is up to them. They can do that. But I guarantee you for the vast majority of women, that's not always the case. So don't underestimate their strength. Don't underestimate their capability because their demands of motherhood are so high. But on the flip side, also understand that there needs to be a recovery process, and the only expectation you can have of them is that we need to acknowledge that there are a ton of expectations on them constantly, and we need to allow that time to allow them to recover. So how do we go about this? How do we judge this narrative? Well, it starts with our language, first and foremost. With any population that we're bringing on strength training, we need to have an understanding and use the right words. I don't do a whole lot of different strength training stuff with my postpartum class compared to a regular class. We take it a little bit slower, and we look at different things, and I talk slightly differently, right? I continually reinforce that they are strong, that they are capable, that what's demanded of them is a lot. But we look at vast different outcomes and results. For some of my patients, usually it could be getting out of pain. For postpartum women, it's getting rid of that feeling of a void in their stomach or their pelvic floor, or it's being able to move without having incontinence, or it's not feeling like their stomachs or insides are going to fall out. A whole lot of different conversations like that need to happen that gets you as a practitioner and your postpartum patient or client on the same page. Because nobody wants to go do a deadlift and have a feeling like their insides are going to fall out. That's not what wants to happen. And many of these women are coming back from a time where they were able to work out, not have any of these issues, and now all of a sudden they are. And they're like, I just want to get back to what I feel is normal. So we need to acknowledge this and realize that the outcomes and results for that are a far different conversation, right? So the conversation needs to change. But for you as a practitioner, that's a difficult conversation to have, right? It is very, very personal, and you need to establish trust very quickly, and you need to be very upfront and understanding with everything that they have going on. If you don't have that ability to have that perspective and have that tough conversation, they don't care. I'm a 26-year-old male. I'm probably not the ideal person to be talking to women about post-pregnancy issues and postpartum issues, but I am because I go into it with a level of confidence and understanding of knowing, hey, I've worked with a lot of women and I've listened to them, and here's what I've heard from them, and here are my concerns. So I'm comfortable with the uncomfortability of that conversation, and they see that, and they in turn trust me and become comfortable with it, and we're able to move on from there, right? So it's then having not just the conversation, but becoming comfortable and confident with it, and that's what it leads to, right? Last, you need to focus on, in regards to expectations, not on time, but on how that person, how that postpartum mom is feeling, right? And we have to separate that a little bit. A lot of docs, when they clear women after that, because usually it's about a 6 to 8 week period after pregnancy that they get cleared for activity, whatever that means, like, oh, just go by how you feel. Well, a lot of women don't know how they feel, especially if they're first-time moms. There's so many things out there that are perpetuated as normal that they don't understand or have the awareness yet of their body in this postpartum phase, right? So we need to be the ones who bring awareness to that, establish what might be common but isn't necessarily normal. We talk about that with incontinence all the time. Women 20, 30 years down the road or who are working out in the gym are like, oh, I always have to pee with double unders. I always pee or leak a little bit with box jumps. That is common, absolutely, but it is not normal. Diastasis recti up to 6-9 months in a high percentage of women is common, but not normal. We need to acknowledge this and understand this and say, sometimes how you feel, we need to bring some awareness to it. And that's the other part of my conversations with these women, is getting an awareness around of that feeling of that void that they feel in their stomach, and then how it relates to their pelvic floor, right? So it comes from the very beginning of acknowledging that the demands of a postpartum mom are extremely high, not just in a physical sense by having that baby carrier or a lot of other things. And imagine if they have twins, right? But also from the sense of that's a ton of emotional stress and emotional everything and taking care of a family that very rarely do they get an opportunity to step back and look at their own health. So we can show them what they're currently capable of and what that recovery process can look like. And that recovery process in itself, we should not base it on the expectation of time or be on the expectation of the rest of society that normally forces moms to get back really, really quick, but simply by asking them how they feel. And if we don't get that right response, we need to bring awareness to how they are feeling and begin to talk about that and really dive in deep with that. And that ability and feeling of awareness can be exactly related to what we look at from a strength training perspective, which is results and outcomes. And those can be vastly different. That can be along the lines of incontinence, of leaking, of bleeding, of pelvic pain, of pelvic organ prolapse, of diastasis recti. When I set squat sets and reps, it often has to do more with how do they feel the contraction of their pelvic floor with the movement, more so than, man, are your quadriceps or glutes tired, right? We get there eventually, but it has to be within the scope and the perspective of the recovery process here is from a traumatic event with the pelvic floor and core, and we need to acknowledge that and build up a linear progression of strength training in the same way we would with other types of MSK issues, right? And last is the language and conversation that is used. There's so much on moms that we need to continuously be reinforcing that they are strong and capable and that this is a recovery process, and give them permission to allow themselves to slow down and recover and take some moments of time to focus on their health. When everybody else asks them about how's the baby doing, they need to know that someone's in their corner for an hour or two a week that is like, how are you doing? And not just when they say, fine, I'm doing okay, or I'm doing great, to really dive into that question of, no, let's really talk about how is your body responding? How are you eating? How are you sleeping? Ask them those questions and know that you're there for the long term through that recovery process, because it's not going to be a 6 to 8 week thing. The recovery process from postpartum is going to be months, 6, 9. As that baby continues to grow, they're going to recover and grow along with them. And we need to acknowledge and be supportive of that and keep that adaptation and that growth in a positive projection for them and not in I'm just trying to survive projection for them. And that conversation, that shift in mindset is what allows you to use the same strength conditioning principles, same movements with these women who want to get back into fitness and CrossFit, but from a vastly different perspective because they are a specific patient population. And I guarantee if you start to work with women like that, if you start to use language like that and give perspective and show confidence that you're comfortable with being uncomfortable about these conversations, especially if you're a younger mid-20s male, they're going to recognize this and they're going to come to you not just for this period in their life, but for the next time it happens and the time after that. And they're going to look at you as not just a physical therapist, but as someone who's looking at their overall health, because you're helping them get back to a lifestyle that they want to live and a recovery process that you've given them permission to go through. All right. So that's that for the PT on Ice today on postpartum strength. If you guys have any questions on this, or more specifically what I do, wasn't big on treatment stuff today. It has to do with the language, the conversation, the expectations, and understanding the capabilities and recovery process of somebody who's going through a postpartum recovery and postpartum strength training. Get that down, and you'll have a vastly different patient population that's knocking down your door at your clinic or your facility. All right, guys. Thanks. Have a great rest of the day.